In the previous module, we introduced 6 principles of medical ethics. We're now going to look at the way they inform some more familiar notions within the context of healthcare. Informed consent is one of the most important ethical principles that guide healthcare practice as well as medical research. We're going to talk about medical research in more detail later in this course. For now, we're going to look into the way the ethical principles of veracity and autonomy justify one of the cornerstones of ethical healthcare practice, namely informed consent. At the normative level, informed consent is based on the deontological principles of veracity and autonomy. Based on the principle of veracity, healthcare providers have the obligation to tell the truth to their patients. In other words, to inform them. While under the principle of autonomy, they also have the obligation to respect their patients' choices regarding a course of treatment. That is, the patient must consent or agree to receive the proposed course of treatment. For that purpose, the patient must make the choice on the basis of truthful information. So both veracity and autonomy are necessary in order for a patient to give informed consent. Here's how it breaks down into more specific requirements. In order for veracity to be met, in other words, in order for information to be properly presented, the healthcare provider has to spell out the pros and cons as well as the probabilities of the possible outcomes of the discussed procedures. The principles involved in this decision-making are beneficence and non-maleficence. When doing risk-benefit analysis, we weigh one against the other. There are 3 general ways to approach this analysis. We could opt for maximizing the benefits, maximizing the ratio between risks and benefits, or for prioritizing non-maleficence over beneficence. So, in order for these principles to be met, the healthcare provider has to present pros and cons, alternative treatments, and the probabilities of their outcomes. We continue with the calculation which of these treatments is better justified based on the probabilities as well as the other values that the patient holds. For example, cost of treatment is going to be a decisive factor. However, the value of money may be in conflict with some other value, such as the value of health. Inconveniences have to be considered as well. This involves considerations of aesthetic values. For example, the comfort of the patient is going to be important in making the decision. How long will the recovery take, for example? What lifestyle changes would need to be made? If somebody is getting an organ transplant, they're committing to a lifetime of taking of medications that are going to allow that organ to be accepted by the body. Also, the patient needs to be aware of the level of the competency of their provider. Are they a resident, a nurse practitioner, or a physician? Any possible conflicts of interest must be disclosed. Many people are concerned about doctors pushing for treatments and medications that they themselves somehow benefit from financially or for the purposes of their research. All of this information has to be clear to the patients. This constitutes the informed element of informed consent. The ethical principle that requires it is veracity, but the consent element of informed consent is grounded in autonomy. As we said before, autonomy requires a person to be able to analyze the consequences of their actions and make decisions based on this analysis. In order to be able to make a decision this way and follow through with it, a certain level of psychological development is required. Thus, in order to provide adequate consent, one needs to be an adult of normal cognitive development. For this reason, minors are not considered capable of providing consent because they're not fully developed. From neuroscience and psychology, we know that the brain development of a 16-year-old is at the level of an adult as far as cognitive capacity is concerned. 16-year-olds could understand the complexity of information presented to them. This is why a 16-year-old may be deemed a competent minor under certain circumstances. However, our brains develop until our mid-20s. Another milestone occurs around the age of 18. This is when the brain's emotional centers develop. At this point, not only do we have the cognitive capacity to analyze a situation, but we also have better control over our emotions and behavior. Yet another milestone occurs when our brains develop fully in our mid-20s. This is when the impulse inhibition centers in the brain develop. This is also a very important capacity that we need to consider, as many of us understand the consequences of our actions, but still cannot control our impulses and may thus jeopardize the course of treatment. So, how can informed consent be ensured for minors? We consider their parents as our proxies and follow the decisions of the parents to ensure that autonomy is upheld. There's the notion that it's important for children to assent or agree with their parents who give the formal consent for their treatment. This is why, in cases where mature minors disagree with the course of treatment that their parents may be pushing, there are ways for them to get an exemption and be granted legal autonomy. Another case which may present similar issues is the case of people with limited cognitive capacity. These could be people with intellectual disabilities, many of whom don't develop cognitively to the level of a 16-year-old. In those cases, again, it's going to be important to have some representative who makes decisions on their behalf. Unconscious people also need somebody to make decisions on their behalf. If a patient is in a coma, but they don't have advanced directives, the next of kin will have to make decisions on their behalf. Here again, autonomy is obviously not going to be exercised by the patient, but somebody is going to be acting as their representative. But if a healthcare provider disagrees with the person who is making those decisions, legal actions could be taken to ensure that the patient's best interest is upheld. In all of these cases, autonomy is somewhat questionable. The patients themselves are not fully capable of exercising their autonomy, but in principle, somebody has to be their proxy and exercise autonomy on their behalf. Additionally, there may be complications that come with comprehension. If somebody doesn't fully grasp the information provided, we can't really say that they're doing something voluntarily. This would be rather obvious in cases where the patient doesn't speak the language that the healthcare provider speaks. This is why it's so important that there are multiple interpreters on staff in hospitals. But of course, in smaller rural areas, it may be a huge issue if there are no people that are competent in both languages and could interpret this way. In those cases, healthcare providers need to be really careful not to make a patient sign a form that they don't understand. This could also be a problem with people with lower levels of education. Even though they may have full cognitive capacity and fluent language proficiency, if they are not familiar with medical terminology, the information cannot be said to have been provided. This is why there is a lot of work that goes into drafting a consent form, and psychologists are involved in these drafts, making sure that the language is at the level of elementary school, so most patients can actually understand what they're being presented. Finally, there may be patients with mental health issues that may not be cognitively impaired in general, but their mental state may put them in an impaired position in some situations. For example, a person who is having a psychotic episode is not necessarily cognitively impaired, but has a limited capacity to comprehend because they don't have a clear perception of reality, let alone what somebody is reading to them. In those cases, they're going to be limited in their capacity to give true consent. This may be particularly difficult in the cases where the patient refuses treatment. And we're going to say more about this when we discuss involuntary treatment. Now let's turn to the right to refuse treatment. The right to refuse treatment is key for upholding autonomy. This also requires truthful presentation of all relevant pros and cons of the course of treatment. If the patients understand the consequences of their decisions, their choices must be respected. An example of a legal argument that upholds this right is a do not resuscitate order. The principles that justify this clinical practice are autonomy and fidelity. In this case, a patient freely chooses not to receive life-sustaining treatment. They should not be under any kind of pressure by anybody. They should be making that decision out of their own free will.